sense. So it's pretty much the transfer. I know the PPE, the personal protective stuff, will all get you outside of that. The whole goal here is it's a group of people that they're trying to get samples on. So the things to keep in mind, number one, is swab, the nasopharyngeal swab, right? Which means basically where you're trying to go is you go in the nostril. And the biggest thing you got to remember is you just kind of rotate as you go along. As you're going east-west, not north-south. Right? Don't go up. That's not what you want to get. What you want to get in 5 minutes or 10 minutes of as soon as possible. Pretty much practically speaking, you may want to collect a couple so you're not opening and closing the toilet. But as soon as they can get, once the sample's collected, the sample degrades.
This probably mostly is going to be with doing like the drive-through testing, where people are just driving up, they turn their head, just reach in, swab, and then you're done. So, okay, all right. So we've got the test procedure part of it down. isolation team. So pretty much spot on. First name is Kermit, Kermit. Last name is Huebner, Huebner. And my official position is that I'm the flight surgeon for the 772nd Troop Command Aviation Western Army.
And if you could talk about the mission that you guys did today and how you executed that mission, sir.
So the mission that we had today was to provide testing support and services to a nursing home to evaluate for residents that may have been exposed to the coronavirus. So we organized a team that included a combination of folks that were trained in chemical, biological, radiological, and nuclear PPE, personal protective equipment, as well as medical providers and medical staff to be able to work together in coordination so that we can do this in a safe manner, obtain the samples, and then do appropriate decontamination of ourselves to ensure that we weren't going to potentially spread the virus outside of the facility.
And what was the reasoning for wanting to use the PAPRs here rather than just the N95 masks? And
so if you look at the CDC guidelines as far as the recommended personal protective equipment that you need, for the most part, as long as you're not doing any kind of invasive procedure that would require generation of aerosols, so things like nebulizer treatments, a lot of times you can take care of patients by just wearing a surgical mask. If you are doing aerosol generating procedures, they do recommend that you use an N95 mask as well as the goggle and the face shield. We tend to focus more on use of the PAPRs and kind of a higher level of protection, not because we feel necessarily that we need a higher level of protection, but with that equipment, we can actually decon that equipment, so we can decontaminate, we can wash it down, and then we can reuse it. And so by using that equipment, we don't have to dig into our stockpiles of our N95 masks and our eye protection as far as like for goggles, so that we can keep that in stock and we can help provide that to the civilian community or for other providers to use in situations where that may be more appropriate.
And final question, sir, just to add, maybe if you could talk a bit about how this was a pretty quick response of the people that were able to come up and pull off this mission. Are there any comments you'd like to say about that, sir?
Yeah, so this was a very quick response. We received notification last night that there was going to be a need for a team that would be able to have the skill set to match up personal protective equipment as well as medical skills to be able to obtain sampling from patients and be able to do that in a healthcare environment where there may be potential for the coronavirus to actually be in the facility. So we received the call, was very quick notice last night to be able to gather the team together. We've never worked together up until this morning, but wearing the green suit and working together amongst the other folks within the National Guard, it was very easy for us to come together as a team, identify the skill sets that each of us had, come up with a plan of action that we could put together so that we could actually accomplish the mission. And we were able to do it not just to accomplish the mission, but we actually did it very efficiently and very effectively.